When assessing an unresponsive patient with gasping respirations, the EMT should first A. Begin chest compressions. B. Insert an oral airway immediately. C. Check for a pulse for no more than 10 seconds. D. Deliver 2 rescue breaths. Answer: C. Gasping equals agonal breathing. Pulse check must be done quickly before initiating CPR. A patient with abdominal pain describes it as tearing and radiating to the back. This may indicate A. Gallbladder inflammation. B. Aortic aneurysm. C. Gastric irritation. D. Kidney stones. Answer: B. A tearing pain radiating to the back is a classic warning sign of a possible abdominal aortic aneurysm. The most reliable indicator of adequate ventilations delivered with a BVM is A. Visible chest rise. B. Audible air entry. C. A fast ventilation rate. D. Strong air pressure in the mask. Answer: A. Consistent chest rise confirms effective ventilation and airway movement. When a trauma patient has snoring respirations, the initial airway intervention should be A. Jaw thrust maneuver. B. Nasal cannula oxygen. C. Suction for 30 seconds. D. Oropharyngeal airway insertion without assessment. Answer: A. Snoring suggests airway obstruction. Jaw thrust opens the airway without neck movement. A pediatric patient with a partial airway obstruction is coughing forcefully. The EMT should A. Begin abdominal thrusts. B. Encourage coughing and monitor. C. Start back blows immediately. D. Attempt blind finger sweeps. Answer: B. Effective coughing suggests air exchange. Intervention may worsen the obstruction. Which finding indicates decompensated shock? A. Cool, pale skin with normal blood pressure. B. Increased heart rate but strong radial pulses. C. Falling blood pressure with altered mental status. D. Warm skin and slow pulse. Answer: C. Low BP plus mental changes means the patient is losing perfusion and is in decompensated shock. In a diabetic patient with suspected hypoglycemia, the most immediate threat is A. High blood pressure. B. Permanent liver damage. C. Brain dysfunction. D. Kidney failure. Answer: C. The brain requires glucose. Hypoglycemia can rapidly lead to seizures or coma. A patient with chest pain describes it as dull, heavy, and non-radiating. This most likely suggests A. Angina. B. Cardiac tamponade. C. Pulmonary edema. D. Musculoskeletal strain. Answer: A. Heavy pressure type discomfort is commonly associated with angina or myocardial ischemia. When ventilating a patient with a stoma, the EMT should A. Seal the nose and mouth completely. B. Use a pediatric mask over the stoma. C. Only use nasal cannula oxygen. D. Avoid ventilation due to airway risk. Answer: B. A small mask fits over the stoma to deliver effective ventilation. After applying an AED, it advises no shock. The EMT should immediately A. Turn off the AED. B. Deliver 2 breaths. C. Resume chest compressions. D. Reanalyze the rhythm manually. Answer: C. No shock indicates a non-shockable rhythm. CPR continues immediately. Which patient requires the FAST-ED stroke assessment tool? A. Patient with severe chest pain. B. Patient with suspected large vessel occlusion. C. Patient with heat exhaustion. D. Patient with minor arm injury. Answer, B. Fast ED screens for large vessel stroke, determining need for rapid stroke center transport. Hypoventilation leads to an increase in A. Oxygen levels, B. Carbon dioxide levels, C. Blood pH, D. Blood pressure. Answer, B. Slow or shallow breathing causes CO2 retention, leading to acidosis. An adult burn covering the entire left arm and half of the left leg equals A. 13.5% TBSA, B. 18% TBSA, C. 22.5% TBSA, D. 27% TBSA. Answer, C. Arm equals 9%, half a leg equals 9%, total equals 18%, but with anterior/posterior calculation it becomes 22.5%. The earliest sign of respiratory distress in infants is A. Cyanosis, B. Nasal flaring, C. Low blood pressure, D. Irregular pulses. Answer, B. Infants compensate with increased work of breathing, starting with nasal flaring. You arrive at a scene where a patient is seizing. Your first action is to A. Place a bite stick in their mouth, B. Restrain their movement, C. Protect the patient from injury, D. Insert an airway device. Answer, C. Safety is priority. Airway interventions wait until seizure stops. A patient with suspected spinal injury complains of tingling below the injury site. This symptom indicates A. Muscular fatigue, B. Early neurological involvement, C. Cardiac-related discomfort, D. Normal physical response. Answer, B. Tingling suggests nerve pathway involvement and possible spinal compromise. Which finding requires immediate assisted ventilations? A. Respiratory rate of 26 with clear lung sounds, B. Respiratory rate of 8 with shallow breaths, C. Respiratory rate of 18 with coughing, D. Respiratory rate of 20 with wheezing. Answer, B. Slow and shallow breathing indicates inadequate tidal volume. While assessing a trauma patient, you notice jugular vein distension and tracheal deviation. This most likely indicates A. Tension pneumothorax, B. Simple rib fracture, C. Pneumonia, D. Cardiac ischemia. Answer, A. JVD plus tracheal deviation are hallmark signs of a tension pneumothorax. When immobilizing a patient with a suspected femur fracture, the EMT should A. Apply manual traction before splinting, B. Rotate the leg outward, C. Allow the patient to stand, D. Apply heat to reduce swelling. Answer, A. Gentle manual traction realigns the limb and reduces pain before splinting. An EMT assessing a patient experiencing anaphylaxis should expect A. Elevated blood pressure, B. Widespread vasodilation and airway swelling, C. Slow respiratory rate, D. Increased stroke volume. Answer, B. Anaphylaxis triggers airway edema, vasodilation, and reduced perfusion. In a multi-casualty incident, the START triage system identifies a patient walking but complaining of dizziness as A. Immediate, B. Delayed, C. Minor, D. Deceased. Answer, C. Any patient able to walk is tagged as minor, green, in START triage. The most important sign of adequate perfusion is A. Normal skin color and temperature, B. Loud breath sounds, C. A high oxygen saturation, D. Fast heart rate. Answer, A. Skin findings reflect circulation and tissue perfusion. When suctioning an adult airway, the EMT should suction for no more than A. 5 seconds, B. 10 seconds, C. 20 seconds, D. 30 seconds. Answer, B. Longer suctioning removes oxygen and risks hypoxia. A patient exposed to a chemical inhalation presents with hoarseness and stridor. This suggests A. Lower airway collapse, B. Swelling of the upper airway, C. Hyperventilation syndrome, D. Gastric reflux. Answer, B. Stridor and hoarseness indicate narrowing of the upper airway from swelling. A trauma patient has weak carotid pulses and absent radial pulses. This finding suggests A. High blood pressure, B. Right-sided heart failure, C. Poor peripheral perfusion, D. Normal circulation. Answer, C. Loss of radial pulses indicates dropping perfusion and possible shock.